in the beginning, I would say that the impact has varied from the first 2 months of COVID, the fear and the anxiety. Not only did we already have that because of public charge, but also the unknown. I think even us, you could say your average person was very concerned of just what exactly was COVID, et cetera. I think for our immigrant community, not only was it just the fear overall, but also the information not being provided in different languages. It did take here within Illinois a few weeks to provide the information even in Spanish. Unfortunately, when it comes to media, it still has not been provided in other languages. Some of it has been provided in Chinese, Arabic, and I believe in Urdu as well, to my knowledge. So that has led to immigrant serving organizations having to do a lot more outreach and education, translating materials, not only on a topic that they were not familiar with, but also just that added burden that they already had in trying to address the issues. I would say lack of information was one, and to add that was the language barrier. The other one, when it comes to the fear, is not only of the unknown, but also, again, similar to other places in the country, is them being, the majority of immigrants being uninsured. Not only undocumented, but overall, whether it be because of the cost or whether it be because their employer does not offer insurance. So there's been many studies showing how not only was the fear preventing individuals from getting tested because of public charge, but also because in the beginning they didn't know that the testing was free, for example. And it wasn't until much advocacy that we were able to get our governor, Governor Pritzker, to publicly say that testing was free for everyone, regardless of insurance and regardless of immigration status. I think to add briefly to that is also the concern of treatment. We have been hearing from both a couple of different local public health professionals and doctors that unfortunately when it comes to the Latino, as well as to an extent the Asian community, they end up showing up to the hospital with more serious symptoms than other individuals. And we think that it's, again, the combination of the fear of immigration, public charge, as well as the cost. And I would say lastly, because our undocumented community, the majority, over 70% of them, do live in mixed status families, it's also that dynamic of some US citizen relative may not seek certain care because they don't want to expose the undocumented individual. So I'm not highlighting, you could say, a lot of, you could say, new facts, but just really want to emphasize that unfortunately it's similar barriers that we have seen in other things. And I would just say that the public charge rule has really further exposed the discrimination and the racism and everything within our public health system, as well as just overall the impact in our community. The new public charge rule, not only does it give permission, authorization to immigration officials to predict, literally to look in the future, based on an individual's current skills, current income, assets, etc., and be able to pretty much predict if that person is going to ever in the future end up relying on the government for any kind of public benefit. And what I mean by skills is they are looking now after February 24th, which is when the rule took effect, the person's education level, income level, credit score, if they have assets, family size, health, if they have health insurance, etc. So it changed just the overall how an individual's immigration application gets examined. And the two groups of people that are mostly affected by this rule are those that are trying to get a visa to come to the US, either adjust their visa, either from a student, for example, to a worker's visa as one example, or those individuals that are trying to get a green card, either going from a visa to a green card or undocumented to a green card.